Ever feel like your body is a perfectly tuned instrument, always working behind the scenes, to keep everything running smoothly?
Hmm.
Well, get ready to have your mind blown,
Okay.
because today's deep dive is all about one of those amazing balancing acts you probably never even think about your blood pH.
Yeah.
You sent us some really intriguing research on acid-base disorders, so clearly you're ready to get a little technical. And trust me, it's fascinating stuff.
Yeah.
Thankfully, we have our expert here to help us unpack it all.
It's a pleasure to be here. And you're absolutely right. pH balance is one of those things our bodies just handle so well that we often just take it for granted. But understanding how it works, what happens when things go wrong, it can give us a whole new appreciation, I think, for just how complex, human physiology really is.
Okay, so back to basics for a second. What exactly is pH, and why should we care so much about keeping it balanced?
So imagine you have a pool.
Okay.
To keep that water, crystal clear, swimmable, you need the right pH level.
Right.
It's the same with our blood. pH is just a measure of how acidic or alkaline it is. And just like that pool, there's a sweet spot, right, where everything functions best. For our blood, that magic number hovers somewhere between 7.35 and 7.45.
That's a pretty narrow range, isn't it?
It is. Even a tiny shift outside of that range can really throw things out of whack. Think of it like this. Imagine those little hydrogen ions in your blood are like these tiny little troublemakers.
Okay.
Too many of them, things get too acidic.
Yeah.
Too few, it becomes too alkaline. Either way, it disrupts your body's delicate harmony.
So what happens when those troublemakers get out of control? What are the real-world consequences of a pH imbalance, in the body?
Unfortunately, they can be pretty serious. Significant imbalances, whether it's too acidic, a condition called acidosis, or too alkaline, known as alkalosis, can wreak havoc on your body.
Wow.
We're talking organ dysfunction, irregular heartbeats, even coma.
Oh, wow.
In severe cases, it can be fatal.
That's a sobering thought. It really highlights how crucial that balance truly is. Thankfully, the research you shared emphasizes just how well-equipped our bodies are to handle these potential crises, right?
Absolutely. We've evolved these amazing defense systems to keep our pH in check. It's a bit like an internal security system, with 3 lines of defense.
I'm all ears. Let's hear about these internal bodyguards. What's the first line of defense?
Our first responders are called buffers. Think of them as the chemical sponges in your blood, always ready to soak up or release those pesky hydrogen ions.
Oh,
If things suddenly get too acidic, they'll absorb those extra troublemakers. And if it swings too alkaline, they'll release a few to get things back in line.
so they're like the immediate action team, buying time for the reinforcements to arrive.
Exactly. And those reinforcements come in the form of your respiratory system, specifically your lungs. Within minutes, your lungs can adjust the amount of carbon dioxide you breathe out. And here's why that's important. Carbon dioxide is acidic. So if your blood is getting too acidic, your lungs say time to step up and increase your breathing rate to expel more CO2. On the flip side, if things are getting too alkaline, they'll slow down your breathing to retain a bit more CO2.
It's amazing how interconnected our bodies are. But it sounds like the lungs are more of a short-term solution, like holding the fort until the real power arrives, right?
You've hit the nail on the head.
Yeah.
And that's where our third line of defense, the kidneys, come in. They're the strategic command center of pH balance. While they're slower to act, taking hours or even days to work their magic, they're incredibly precise in how they fine-tune things.
So how do the kidneys actually go about restoring order?
They're masters of filtration and excretion.
Okay.
They can adjust the amount of acid and bicarbonate. That's another one of those important buffers we talked about that gets filtered out of your blood and into your urine. So if there's too much acid in your system, the kidneys will make sure it's flushed out, and if there's too little, they'll hold on to it. They're constantly monitoring and adjusting to keep everything in that perfect 7.35 to 7.45 range.
Wow. It really puts a whole new spin on the phrase taking out the trash, doesn't it?
Right.
Our kidneys are like the ultimate multitaskers, filtering waste and keeping our blood pH perfectly balanced.
Exactly. And it's all happening without us even realizing it. It's a testament to the remarkable efficiency of the human body.
But as with any complex system, sometimes things can go wrong with this intricate dance between our buffers, lungs, and kidneys. And that's where the disorder part of our deep dive comes in, right?
That's right. The research you shared delves into how these acid-base balancing acts can be thrown off, leading to some pretty significant health problems.
Which makes me even more fascinated to hear about those clinical cases. But first, can we break down the different ways this balance can be disrupted? What are the main types of acid-base disorders? So those are the players in this delicate balancing act: our buffers, our lungs, and our kidneys.
Right.
But as we know, even with the best defenses, sometimes things go wrong.
Yeah.
The research you shared breaks down how this intricate acid-base balancing act can be thrown off.
Exactly. And when it comes to acid-base disorders, there are four main culprits, each with their own ways of disrupting the balance.
Yeah, let's break those down. What's the first type of disorder we should know about?
First up, we have metabolic acidosis. Remember how we talked about the kidney's role in filtering out excess acid?
Right?
Well, when they're not doing their job efficiently, or if your body's producing too much acid for other reasons, that's when metabolic acidosis can occur.
So it's like the kidneys are falling behind on their trash removal duties, and those acidic troublemakers start piling up.
Precisely. Now, on the flip side, we have metabolic alkalosis. This happens when you lose too much acid from your body or have an excess of bicarbonate, which, as you recall, is one of those important buffers that keeps things from getting too acidic.
So metabolic disorders are primarily linked to how well the kidneys are doing their job.
You got it. Now, our other two culprits involve the lungs and their role in regulating CO2.
Right, because too much CO2 makes the blood more acidic.
Exactly. So when your breathing is impaired, like in certain lung diseases, CO2 can build up in your blood, leading to respiratory acidosis.
That makes sense. And then respiratory alkalosis would be the opposite, right?
Absolutely. If you're breathing too rapidly, like during a panic attack, you're actually expelling CO2 too quickly, tipping the scales toward being too alkaline.
Okay, so we have metabolic acidosis and alkalosis, which often point back to the kidneys, and we have respiratory acidosis and alkalosis, which are all about the lungs and CO2. Four main ways things can go haywire. It's a lot to keep straight, but thankfully, the research you shared doesn't just throw these terms around, it brings them to life with some really fascinating case studies. I'm ready to jump into those if you are.
Let's dive in. These cases really illustrate how acid-based disorders can manifest in very real and often unexpected ways.
Okay, case study number 1. The diabetic patient with lactic acidosis. This one caught my eye because I don't think most people realize that a common condition like diabetes can be linked to acid-base imbalances.
It's a crucial connection. This case involves a 58-year-old woman with type 2 diabetes. She's been feeling fatigued, lost her appetite, and is experiencing some abdominal discomfort and nausea. Now she's been taking metformin, a medication commonly prescribed for type 2 diabetes.
Metformin helps regulate blood sugar, right? What does that have to do with pH?
It's all about how metformin works in the body. In rare cases, metformin can interfere with the breakdown of lactic acid. Lactic acid, as the name suggests, is acidic.
Okay.
So when it builds up in the bloodstream, it can lead to, you guessed it, lactic acidosis.
So that explains the lactic acidosis diagnosis. But the case study also mentions she recently started taking diclofenac for knee osteoarthritis. Is that relevant?
It could be. Diclofenac is a type of NSAID, a non-steroidal anti-inflammatory drug, and like some medications, it can have potential side effects. One of those side effects, in some people, is that it can affect kidney function.
And if the kidneys aren't functioning optimally, they can't remove excess acid as efficiently.
Exactly. So in this case, you have a patient taking metformin, which carries a small risk of lactic acid buildup, and diclofenac, which might be impacting her kidney function. It's like a perfect storm for developing lactic acidosis.
It's a good reminder that all medications, even over-the-counter ones, come with potential risks and benefits.
Absolutely. And it highlights the importance of having open conversations with your doctor about your medications, especially if you have underlying health conditions like diabetes.
Okay, on to case study number 2. Chronic constipation and unexpected alkalosis. Now this one threw me for a loop. Constipation causing an acid-base imbalance. How is that even possible?
It is surprising, isn't it? This case involves a 65-year-old man with a history of chronic constipation. He recently underwent surgery and was prescribed lactulose to help, get his bowels moving again.
Okay, so lactulose is a laxative, but how does that tie into alkalosis?
Well, lactulose works in a rather unique way. It's not absorbed well in the digestive tract. Instead, it stays in your gut and pulls water in, softening the stool. But in the process, it can also lead to a loss of electrolytes like potassium through the stool.
Electrolytes.
Okay.
I vaguely remember those from high school chemistry, but remind me, why do we need them?
Electrolytes are essential minerals that carry an electrical charge when dissolved in fluids like our blood. They play a vital role in many bodily functions, including, you guessed it, maintaining pH balance.
Ah, there's the connection. So this gentleman loses potassium because of the lactulose, and that throws off his electrolyte balance, ultimately leading to alkalosis.
Exactly. It seems counterintuitive because we often associate diarrhea with dehydration and a loss of fluids. But in this case, the loss of potassium, driven by the lactulose and the diarrhea, is the primary driver of his metabolic alkalosis.
It's a reminder that sometimes the human body's response to a problem, in this case constipation, can have unexpected consequences elsewhere. It's all connected.
Couldn't have said it better myself.
All right,
Ready for case study number 3.
bring it on. Okay, on to case study number 3. Pneumonia and the struggles of acidosis. This one, hits close to home for a lot of people, I think, because pneumonia is just so common, especially as we get older.
It is, unfortunately. And this case really underscores how a respiratory illness can disrupt our pH balance. We're following a 65-year-old man who's hospitalized with worsening pneumonia. He's having a lot of trouble breathing, and his blood tests show that he's gone into respiratory acidosis.
That makes sense, right? Since we've been talking about how the lungs play such a crucial role in regulating CO2.
Exactly. When you have pneumonia, the air sacs in your lungs, they become inflamed and filled with fluid, which makes it much harder for your lungs to do their job of exchanging oxygen and carbon dioxide.
So instead of getting rid of enough CO2 through breathing, it starts to build up in his blood, making it more acidic.
You got it. It's like trying to breathe through a straw.
Wow.
And what's remarkable is that even in the face of this illness, the body tries to fight back.
Mm.
The paper mentions how the kidneys, in this case, try to compensate by holding on to more bicarbonate.
Bicarbonate being that important buffer that helps neutralize acid.
Precisely. The kidneys are like, okay, lungs, I see you're struggling, so we're going to pick up some of the slack here. It's a prime example of how our organs work together to maintain balance.
It's like a whole internal support system we never even realize is there until something goes wrong. Okay, 2 more cases to explore. Case study number 4. Too much of a good thing. Alkalosis in the ICU. This one has me intrigued. What's the story here?
This one is a fascinating look at how even life-saving interventions can sometimes have unintended consequences. We're looking at a 72-year-old man who had a stroke and is now on a ventilator in the ICU.
Ventilators are essential for helping people breathe, especially after a serious event like a stroke. So how does this tie into alkalosis?
It all comes down to the ventilator settings. The ventilator is essentially breathing for the patient, and it needs to be calibrated very precisely to mimic the body's natural respiratory rate.
So the ventilator is set to take breaths at a certain pace and depth to make sure the patient is getting enough oxygen.
Exactly. But here's the catch. If the ventilator is set to remove CO2 at a faster rate than the body's producing it, it can actually lead to respiratory alkalosis.
So it's like accidentally tipping the scales too far in the other direction by removing too much CO2.
Precisely. It's a delicate balance.
Yeah.
And in this case, the patient's blood work revealed that he had indeed developed respiratory alkalosis due to overventilation.
It's a good reminder that even with incredible medical technology, monitoring and, careful adjustments are crucial.
Absolutely. Even life-saving interventions require a nuanced approach. Okay, ready for our final case study.
Bring it on. What does case study number 5, a perfect storm of mixed acidosis, have in store for us?
As the name suggests, this case highlights how things can get really complicated, especially in critically ill patients. We're following a 23-year-old patient who is in septic shock and experiencing severe respiratory distress.
Septic shock is incredibly serious, right? Isn't that when the body has an extreme reaction to an infection?
You're exactly right. It's a life-threatening condition that can cause a cascade of problems in the body, including a dangerous drop in blood pressure and multiple organ failure.
So how did this young patient end up with both metabolic and respiratory acidosis?
It's a two-pronged attack, unfortunately. First, the septic shock itself disrupts the body's normal metabolic processes. This can lead to an accumulation of acids in the blood, including lactic acid. Remember that from our first case study.
Right.
So you have metabolic acidosis occurring due to the body's extreme response to the infection.
And then the respiratory distress further complicates the situation.
Exactly. The patient is also experiencing something called ARDS, or acute respiratory distress syndrome. Essentially, this is a severe lung injury that makes it incredibly difficult to breathe. And as we know, impaired breathing can lead to a buildup of CO2 in the blood, resulting in respiratory acidosis.
So it's like a double whammy of acidosis, impacting both the metabolic system and the respiratory system?
Precisely. And as you can imagine, these cases of mixed acidosis are often incredibly challenging to manage. Doctors are dealing with a critically ill patient who's experiencing a severe imbalance on multiple fronts.
It really highlights the complexity of this balancing act we've been talking about.
It does. And it underscores just how vital it is for medical professionals to understand not just the individual components of acid-base balance, but how they all fit together.
Wow, what a journey through the world of acid-base balance. We've covered the basics of pH, explored the body's intricate defense mechanisms, and even delved into some real-life cases that demonstrate just how quickly things can go wrong.
It's been a pleasure diving into this with you.
Before we let you go, one last question for you. The research we've been discussing focuses on the medical aspects of acid-base disorders. But are there things we can do in our everyday lives to support our body's natural pH balancing act?
That's a great question. While this research focused on the clinical side of things, there is a growing body of evidence suggesting that lifestyle factors can play a supporting role in maintaining a healthy pH balance. Things like eating a balanced diet, staying well hydrated, managing stress, and getting regular exercise can all contribute to overall health and, in turn, support healthy pH regulation.
It's all about taking a holistic view, right? Supporting our bodies through healthy habits while also seeking professional guidance when needed.
Absolutely. It's a team effort.
And there you have it. We hope this deep dive has left you with a newfound appreciation for the incredible balancing act constantly taking place within your own body. For our listener, thank you for sending us this research and for trusting us to guide you through it. Until next time, stay curious.